Hello, this is Dr. Crose with Capitis Medical and Aesthetics. I'd like to answer a question that I commonly receive inside my practice, which is PRP versus stem cells and stem cell exosomes. Well, I'd like to first start off by saying PRP has been around for quite a long time, as well as PRF and all its variations. And basically what you're doing is you're harnessing the healing capacity within your platelet cells by activating the release of the small vesicles inside them that contain growth factors and cytokines and different communication methods used by the cells to actually coordinate the healing process. But one of the things that happens with this is you also get inflammation. So whenever you use PRP or PRF, it will heal and release growth factors, but it also causes inflammation. The quantity of vesicles that are released from the platelets itself are also fewer, so it's going to take multiple rounds to get the same potency and efficacy as you do with exosomes. Whereas stem cells, they're a little bit more dynamic, which is kind of cool if they survive the actual injection and transplant process. They actually will communicate with the cells in your body, receive signals from the environment, and augment the signals and the exosomes that they're releasing into the area, and they will actually do very well. But the studies out there vary in terms of their capacity to survive within the body after injection, from as little as a few hours up to a few weeks. So this is to be determined with further studies into this. I kind of look at them as kind of a long-acting drug. When you put them into a body, it's almost like a depot injection. It responds but slowly releases a signal that modulates the behavior and the healing capacity of its environment. Whereas stem cell exosomes, which are the actual signals that these stem cells released and use to communicate with other cells, they are very potent, and they are actually what's doing the work of the stem cells. So if you get stem cells and you grow them in an environment and stress them under either low oxygen or high carbon dioxide, or even sometimes exposing them to cortisol or different things like that, they will actually release different signals or exosomes that are that correlate with the stress environment of the human body. And you collect these signals, you purify them, concentrate them, and then you can actually inject them. And because they're smaller and you can concentrate them, it's a much more potent punch than the stem cells themselves. For instance, I can give you 100 million stem cells, but very, very slowly, because it's going to possibly cause a mild reaction in you if I give you that much. Whereas if I can easily give you that much in exosomes, the equivalent in potency, without any problems or side effects. And the exosomes are much smaller, so they actually can pass through the blood-brain barrier and pervasively go to the whole body. So in a lot of ways, the stem cell exosomes are the new generation, and where we're going in this field. I can go on forever on this. There's pluses and minuses in all of these, but ultimately we are moving away from PRP and going towards more potent regenerative options like stem cells and stem cell exosomes. I hope you have a wonderful day. This is Dr. Crose.